Thank you. I'm Dr. Natalie Schenker. I'm one of the co-founders of the Human Milk Foundation, and I've been on this adventure for about 3 years now, and this is another evening that is just taking the adventure to a whole new level. And I'd really like to thank Caroline Swanson for sponsoring us. She lives in our hometown where the Human Milk Foundation is based, just north of London, and really exemplifies the issue that we're facing at the moment, which is taking a charity that only launched less than 18 months ago, that primarily had largely a local focus, but is rapidly going national and even international at a rate that we need some help and resources to help with. Last week we won a, I didn't say one, but we were given a standing ovation at the UNICEF conference of 1,000 people. They don't give all those away lightly, but what we're doing is a little bit special, and it's a real honour to tell you about it. So could I just ask, in the room, how many of you had heard about human milk banking before you'd heard us that we were coming? So, more than my usual audiences. But this is part of the problem, is fewer than 1% of the population has heard of milk banking as a service, and yet, as with blood donation for certain groups of babies, it can be truly life-saving. My work before going into research was in paediatric surgery, and a large proportion of my days and weekends and nights was looking after babies who were very sick, very premature, and including babies who suffered a devastating complication of prematurity called necrotizing enterocolitis, shortened to NEC. It's a condition where the gut dies, either small parts or all of it. And a baby who's doing quite well can become very sick and die within just a few hours. More babies die in the UK of necrotizing enterocolitis than childhood leukemia, and yet few people are talking about it. And what I didn't know back then, but I found out during my PhD talking with Gillian Weaver, who's my co-founder in the audience, is that one of the ways to prevent NEC is by having access to human milk. Preferably the mother's milk, that specially tailored fluid for that baby that helps protect their immune system. But when that's not available, then screened donor milk, that acts as a bridge to support mothers to have time to establish their own feed safely. So I was listening to Gillian talk about the problems in the sector and thinking really there was a real compelling case from a public health perspective, and that something needed to be done. So what we did was set up a non-profit and eventually a charity milk bank called the Hearts Milk Bank. And it's been a real struggle, I can't even tell you. But things have started to change in the last year. So since we launched last August, we were awarded a new Radical Award by the Observer, so one of 50 organisations in the UK, really trying to drive societal change for good. And then earlier this year, Theresa May awarded us a Points of Light Award to acknowledge our voluntary efforts. And how do we work? So mums with surplus milk contact us. They're screened much as if they were donating blood. We take blood tests and give them questionnaires. And then their milk is brought in and heat treated using specialist teams with special equipment to make sure it's safe and that no harmful viruses or bacteria get through. And then these guys turn up. This is Andy, who's one of the blood bankers, a local charity, but we work with the national network to get milk to now 13 neonatal units. This is our local one down the road on the first day that donor milk arrived. They've never had access to it before. But all we've done is take the logistics out of a cash-strapped NHS and give it some light and some freedom. We now provide 13 neonatal units, mainly across London and the South East, but extending further beyond. And we've always had more milk than hospitals have needed. So we've also supported nearly 100 families now where breastfeeding's been impossible. The mothers are battling cancer or have no breast tissue. Or, interestingly, those who are just trying to establish their own supply. But it's a period of life, new motherhood, that's really tucked away from our public consciousness, and resources and support for new mums have been stripped out, particularly in the last 10 years. So, I guess all of this comes into a single story, which is exemplified by Sarah and Rowan. They were born 3 months ago at a hospital that actually had a milk bank, but they were born 2 months early, not 3, which was the cut-off for them to access donor milk. They were born early because their mum was seriously ill and was in intensive care for a couple of days. And actually I was having lunch at home when I was on call that weekend and the phone went, and it was a very frantic dad trying to desperately source some donor milk, because he knew, they'd talked about it before the birth, that she wanted to breastfeed and she really wanted the babies to avoid formula, and they were so little. Fortunately, by that stage, we were at a time that we could get donor milk to this family within an hour, and they're doing fantastically well now. So donor milk is a scarce resource. If we had a national milk bank, we would be able to save at least 250 lives a year. And Flick is going to tell you exactly how we can do that.
Thanks, Leslie. So as you've heard, there's a huge unmet need for donor milk, and we desperately need to grow the milk bank in order to provide for this. We don't want to have to say no to any mother that approaches us, but we are saying no to milk donors every day, and their milk could go towards saving a baby's life. But it takes time and resource to do that, all of the screening, so we need to grow our team and hire a new team member to help us to actually get every single mother in and say yes and help more babies. If we reach our target of £6,000 tonight, it really would be game-changing for us. We could recruit 100 new donors immediately, and that would feed 2,000 babies, and at least 60 babies' lives would be saved. There are other ways that you could support us as well. We're a small team, but we need specialist skills in things like finance, coding, design. Networking and speaking opportunities are fantastic. We believe in collaboration and couldn't achieve this huge goal that we have without working with like-minded people who want to make a difference. And we've helped over 1,000 babies since we launched, but there are so many thousands more. It really is the difference between life and death, and for parents like Chris and Joe Rogers, like you heard, it's the difference between despair and hope, and we can make that difference together. Thank you.